This video introduces the CHEETAH trial hospital baseline characteristics form and some of the issues you'll need to work through when completing this form. But firstly, a quick reminder about the CHEETAH trial. Its primary objective is to determine whether a change of gloves and sterile instruments before abdominal wall closure reduces surgical site infection in clean contaminated or dirty abdominal surgery. The CHEETAH trial is an international, multi-center, cluster randomized controlled trial. This means the hospitals are being randomized rather than patients. So, each hospital will be randomized either to the intervention, which is change of gloves and instruments, or to the control arm, which is to continue the current routine hospital practice. Any patient who will have an abdominal incision of 5 cm or greater with clean contaminated, or dirty classification of their wound is eligible to participate in the CHEETAH trial, apart from patients having a caesarean section. Because CHEETAH is a cluster randomized controlled trial, in order to reduce bias, we need to make sure that consecutive patients are entered into the trial. This means that every patient who meets the inclusion criteria should be included in the theatres taking part in the trial. So the first step is to think about which specialties are going to participate in your hospital. This could include upper gastrointestinal and hepatobiliary surgery, colorectal surgery, gynecology, urology, and perhaps some other specialties. And both emergency and elective patients could be included. So based on what specialties you think are going to take part, you can then work out which theatres in your hospital need to participate. Some surgeons in some hospitals are able to influence practice across all operating theatres in those hospitals. They may be able to train the theatre staff across all those operating theatres to implement the CHEETAH intervention. In larger hospitals, this may be challenging, and so you may need to restrict yourself to the theatres where your selected specialties most frequently operate. So, you will either select all theatres to take part if you think that's feasible, or you might select a smaller number of theatres in your hospital to take part in CHEETAH based on the specialties and the setting, emergency and elective, where you think it's realistic for you to influence practice and ensure that theatre staff and surgeons are implementing the intervention. In the next video, two surgeons discuss which theatres in the hospitals will be able to take part in the CHEETAH trial. So we're just having a chat today about what theatres you're going to be involving in the CHEETAH trial. Okay. So maybe we can first start off, Anil, you can tell us a bit about your hospital.
So I'm a colorectal surgeon, and my hospital's got about 1,000 beds, so it's fairly big, and we've got lots of different specialties. And all the specialties are slightly different, like cardiac surgery, neurosurgery, colorectal surgery. And we've got about 25 operating theatres.
Okay. Johnny, your hospital's quite different. Maybe you can tell us about that.
Yeah, actually it's very different. So we have much less operating theatres. We just have 4 operating theatres. I am a general surgeon. We don't have as many specialties as any other hospital. We just have orthopedics there and obstetrics and gynecology.
And general surgery.
And general surgery, of course.
Okay. So, Anil, have you had any thoughts about what specialties you're going to involve in the CHEETAH trial?
I have, and it's interesting hearing about Joanna's experience too, because gynecology and obstetrics is done in a totally different hospital. So I don't think I'll be able to include them.
Okay.
So within my hospital, I'd definitely be able to include my own team and all the general surgery. I think I'd be able to include the emergency surgery, But the urology surgery, again, that's done in a different part of the hospital. I don't think I'll be able to include that.
Okay, so you can involve the elective general surgery and the emergencies.
Yeah.
So which theatres are you going to be involving?
Okay, so to get all of those cases, I'd have to include, we do all our general surgery in 2 theatres, that's Theatre 11 and Theatre 12. And then our emergency theatre is in Theatre 17. Now, although that's shared across different specialties, so some of the head and neck surgery goes in there, some of the hand surgery goes in there, most of our emergency general surgery goes through there. So I think I'd definitely include Theatre 17.
So those 3 theatres are going to be the ones you choose to run the CHEETAH trial in?
Yes, I think that's a good plan.
It's realistic to train the theatre staff in those theatres to take part?
Yeah, and I think that's manageable, and I think that we could get all of the eligible cases going through those 3 theatres.
Okay, fantastic. And what about you, Joanna? What theatres do you think you're going to be involving?
Okay, so for elective surgery, we have the main general surgery operating theatre and the main gynecology and obstetrics operating theatre, and then we have 1 emergency room. So those 3 operating theatres would be our target.
Okay, so 3 out of 4 theatres.
Yeah.
And the orthopaedic theatre,
yeah,
you're not going to involve because,
yeah.
of course, orthopaedic cases aren't included in CHEETAH. Okay, fantastic. Thank you very much both for your time. Once you have determined which specialties and theatres will be participating in the CHEETAH trial at your hospital, you can start completing the baseline hospital characteristics form. This form asks you to record your selection of specialty and theatres. It also asks for some background information, such as whether your hospital accepts referrals from other hospitals and the total number of theatres available in your hospital, including both those that will and will not participate in the trial, and how many eligible patients you think you'll be capturing in the CHEETAH trial each week. There's a further section of the baseline hospital characteristics form which asks you to confirm what your hospital's current practice is regarding both glove change and instrument change immediately prior to closure of the abdominal fascia in clean, contaminated and dirty procedures. Finally, you will also need to think about whether you plan to include children in the CHEETAH trial and therefore what the minimum age for participants in the CHEETAH trial will be.